This program is brought to you by Fast Signs of Durango. More than fast, more than signs. Fast Signs.
A local physician says it's time for society to stop treating heroin and prescription drug addiction as a moral weakness and to start treating it as the disease that it is. Dr. Daniel Kaplan has treated his share of addicts in his 25-year career as an emergency room physician in the Four Corners region. Now he hopes to give addicts a chance to kick the habit through a new outpatient clinic that opened this fall in Durango. It's called Southern Rockies Addiction Treatment Services, and Dr. Kaplan provides medical treatments like methadone, counseling, and general medical care for people who are addicted to heroin and prescription drugs like Oxycontin, Percocet, morphine, and other narcotic painkillers. Kaplan says the most common gateway to addiction is a painful injury or surgical wound that doctors treat with heavy doses of opioid medication. But recent research indicates that 1 in 20 patients has a genetic predisposition to become addicted to opiates. Their brains and nervous systems literally process the opiates differently and provide a rush so profoundly pleasurable and withdrawal symptoms so profoundly painful that kicking the drug without medical intervention is impossible.
The tragedy of the heroin addiction is that it's a genetic-based addiction. It's not something people choose. So the way we look at it is everybody's one injury or painful condition away from being an addict, and they don't know it ahead of time. So doctors innocently prescribe opiates for your knee pain or back pain or your migraine, and you have about a 1 in 20 chance, if you have the right genetic predisposition, genetics, to become addicted after 7 to 10 days worth of exposure.
Kaplan is board certified in addiction medicine and says that a recovering addict who uses methadone to overcome his disease is no different than a diabetic who uses insulin to control his blood sugar. Both drugs help the patient live a normal life. Joel Smith is one of the clinic's first patients. He became addicted to Oxycontin after the painkiller was prescribed for a dislocated shoulder following a skateboarding accident. What started as a therapeutic pain treatment turned into a $2,000 a week habit. He finally sought help this past fall after spending 3 days in a Durango detox center, only to come out craving more drugs. Smith takes a daily dose of methadone to control his cravings, and he's thankful for the medication.
This has helped my emotions. I'm not all over the place. I'm totally level. I'm like myself again, and it's a blessing.
Since opening in mid-October, Southern Rockies Treatment Services has helped about 45 patients overcome their addictions. The clinic serves patients 18 and older, but hopes to expand services to adolescents in the near future. If you'd like to know more about Dr. Kaplan's addiction treatment services, visit the clinic's website at srats.net.